Hello, viewers. Welcome. My name is Omwech Collins. Welcome to the Health and Hustle podcast. Today is our very first episode of the podcast, and we have a very special guest on the show. He is a chiropractor, an actor, and an entrepreneur. He has a very great story, and we need to know exactly how he goes, what he does for a living, where did he come from. I mean, it's everything we need to know. Dr. Greg.
Yes, Collins.
Salzman.
Hello.
Welcome to the show.
Thank you.
Good. Now, you're originally from the US.
I am.
And you're in Uganda.
I am.
Tell us about that.
I came here before COVID. I think we're on 7 years now. And I came here, I was vacationing in Asia, and I found myself doing gold here.
In Uganda.
In Uganda, Kenya, South Africa, Rwanda, and thank God that didn't last so long. I didn't have a career in that.
Okay, that sounds pretty good. So how do you get to know about Uganda, and how do you end up in Uganda? Of all countries in Africa.
I had a friend named Mo in the States. He was the only person I knew in Uganda, or from Uganda. And I had met him a few years before I came. And I always said, oh, one day I would love to see Africa, I'd love to see Uganda. And then I made it here because of the gold. And then I called him from Kampala. And I said, I am in Kampala. And he says, you're in my country now. And I was like, yeah, I'm in Kampala. I said, the traffic is absolutely crazy. And he says, put your phone away. They're going to steal it.
They're going to steal it and snipe it
right.
through the window.
And that's how my that was like my first day in Uganda.
Actually, that's one of the best welcomes you'll ever get in Uganda, especially in Kampala.
He says, get off the phone and put it back in your pocket.
So, our show is called Health and Hustle.
Yeah.
So we dive deep into health part of it, and then we also get to know what our health experts do besides just health.
Okay.
So it says you are a chiropractor.
Yes.
And then you're an actor, you're an entrepreneur. Why don't you tell us about that? How do you get from being a chiropractor to entrepreneur, then to acting,
I mean, I'm wearing this hat, right? But I can immediately take another hat and switch my whole look. I mean, my bread and butter is chiropractic. But the art of chiropractic it's in talking to the patient, it's in building up relationships. So if you really want to say, what do you need to be a chiropractor? What qualities do you need to be? It's not medicine where people are sick and you don't need a personality. Like, people just come to the medical doctor, they don't have to talk, they just write the prescription and send you on your way. If a chiropractor, anywhere in the world, it's a holistic healthcare, it's not primary healthcare where a patient comes to the chiropractor like a medical doctor in that sense. So a chiropractor needs to flourish, he really needs a personality. He needs to connect with
you need to know the patient before you
connect with their personality, explain to them, using models and different things, like what your purpose is. So I don't consider myself an actor. I do consider myself an entrepreneur. I've tried about 16 different businesses in Uganda.
16 different businesses in Uganda.
16 different businesses.
And that's just only Uganda?
That's just Uganda, yeah.
I mean, how do you end up with 16 different businesses?
Well, so there's a lot of offshoots of what I do. So, for example, I'm really heavily into nutrition.
Yeah.
Because if I want to help the patient,
you need to...
nutrition is a huge part of that. So, I had started making my own supplements. And then when it came time to get past UNBS for certification, we just seemed like it was taking so long. So we had to bag the project because it was so expensive to continue trying to start a company without having the certification.
So the supplements are they're related to your profession of chiropractic?
For my brand of the way I practice chiropractic, 100%. Because, if you want to talk just musculoskeletal, issues like, a bad low back or a knee injury, then you're talking about inflammation. But we know that there's things that will reduce inflammation better than ibuprofen or paracetamol or muscle relaxers like naproxen. And those things really do hurt the liver and the kidneys. So taking a lot of medication
It's actually not good.
is, I mean, in my
It's good, it's not
opinion,
good.
it's good for those situations that it's really needed. But in the, you know, if you really want to look at the whole picture of getting healthy, you want to bring down inflammation naturally. So there's a plethora of herbs and different things like icing properly, knowing how to ice, not using heat improperly, which people don't really, they're not educated on how to use these things properly.
Okay, now we shall get to that part of educating Ugandans how to use that properly.
Yeah.
But for now, we need to know who Greg is.
Okay.
Okay, so you start chiropractic in the US?
Yes. Yes.
Okay, so how do you get yourself into the chiropractic? Is there like you go through a course? Do you need to be
Right.
chosen by what you're good at? You go to the university?
So yes, so
Yeah.
when I was 12, I had
Yeah.
gone to a chiropractor, and my chiropractor was jumping off the walls with personality, and
Okay.
he wasn't dealing with blood. I knew I didn't want to be like with blood. I wasn't that type of doctor, but I always wanted to be a doctor or be helping people in that way. So I was fortunate that at 17 I was already done with high school, and I started my college curriculum a few months before my 18th birthday.
Okay,
So-
just to break it in between that. So college in the US, is it like the university or it's in between the university? Because here we have high school, then we have upper high school, which is advanced 2 years. Then right after that, you go to university. But before you go to university, you have to go through that upper high school.
We don't
then you
have
can
that.
choose. You don't have
Yeah, we don't have upper high school.
Okay,
So most people finish high school at 18.
18.
But I think because my birthday is October, so I'm one of the younger ones in my class. So it just happened to be that I was still 17 when I entered
Okay, so
university.
So at 17, you enter university, then you go straight to study chiropractic.
Yeah, and then I go straight for what's called the undergraduate program. So right now it's an 8-year program. But
8 years.
when I was in school, it was still, you can get by with some of the programs for 6 years or 7 years. But now there are no chiropractic colleges that would be less than 8 years, which means 4 years undergraduate studies, because you still need something like 120 hours of university courses, and they have to be specific in the areas of physics, chemistry,
Okay,
organic chemistry, biology. These are the prerequisites for all health
That sounds,
practitioners.
it sounds pretty similar to ours here, because before you choose to go and study medicine, you need to have done sciences
Yeah.
in advanced level, which
Right.
is 2 years. So you need to specify in like chemistry, biology, physics.
Exactly.
And you combine
So
those two, then go to university.
I
It's the same thing.
I was a biology major.
So now that makes sense.
Right.
Okay.
But then
Yeah.
I had enough requirement hours met that by 19 I was already in the graduate program. And before I was even 21, I was already in my rotations for seeing patients. So I was a bit young.
When you started.
I was always felt too young. Seeing patients at 20 years old.
At 20 years old, you're already seeing patients.
Yeah, I was already seeing patients at 20 years old.
Oh, that was fast.
In the clinic. And then I graduated, I was 23. So I was still young as a doctor. I was still only 23 years old.
So that's when you started practicing after graduating, or it was even before?
Then right after I graduated, I started practicing, working for somebody, getting my first year under my belt, making all the mistakes that new people make.
Have you met any chiropractors in Uganda?
So there's 5 of us
in
Uganda, yeah.
Okay. So there's a number of them.
There's some in Jinja. There's one. I'm the only one in Entebbe that I know about, and there's some in Kampala.
I didn't know who a chiropractor was. I didn't even know they even existed, not until I met you.
Right.
So I'm pretty sure I'm not the only one who's going
Right.
through the same thing.
Right. Most
So why
people
don't you
don't know what
explain
it
to us
is.
what chiropractic is
Okay.
and what exactly they do?
I'm gonna get a bit technical, but chiropractic
Yeah,
is.
we'll break it down in
Yes.
pieces that you can
But
understand.
it's an art,
Okay.
it's a science, and it's a philosophy.
Uh-huh.
Okay, and those three components are the 3
Art,
pillars.
science,
and philosophy.
Okay.
So the science we know, having all the coursework and medical classes and stuff like that. You need to know your bones and your muscles and you need to know anatomy. You need to have a basic working knowledge of science. The philosophy is what dictates your headspace. Like, how do I want to see my patients? Do I want to compete with medical doctors? Do I want to be more holistic minded? How do I want to just be there for a patient with back pain, or do I want to be there for a patient with any kind of deep, issue in the body that may not be ready for medicine yet? It could be that they're pre-diabetic. In other words, they don't have diabetes yet, so they don't need diabetic medication, but they're not taking care of their diet correctly, and as a result, there's signs and symptoms that show that they're on their way, that if they continue down this pathway,
then
they will be a diabetic.
Okay.
So medicine, as we know it, doesn't have a program or a drug, or there's nothing. They could only wait for you to become a diabetic.
Okay.
But I can also be very interested in taking care of their health before they become a diabetic, so they don't have to become one. So there's a whole world of preventative medicine. And me and my philosophy is to be not just there for muscle aches and pains, but to be there for preventative medicine.
So you want to get it before it gets to the other end?
I want to catch everything I can in health before they actually need to be either cut open or medicated. I want to be all of that world before that medical necessity becomes a medical necessity. That area, that gray area where people don't know who to see or what to operate, where I could look at somebody's body and the whole body's a map. Right? People's nails will tell you their health, their eyes will tell you their health, their skin tone,
how they talk, walk,
every aspect. There's a map all over the body, tons of maps. Okay? And the idea for me as a holistic practitioner, so I am a chiropractor, right? But I position my philosophy in a way that I am a holistic practitioner, that I want to practice holistically, preventatively, pre-medically. So I have patients who come here with every type of disorder. And if I can help through either my intuition or my experience,
you would.
Then I help cases that I never knew I can help. Then I want to be that person, So I can't cure cancer, but boy, I can give you a lot of information that can help your body to strengthen your immune system to help that cancer. But I'm never going to say I can cure it. But I can tell you that, well, hey, if I had it, these are the things I would do to take care of my immune system. So perhaps my immune system can beat the condition or the disease.
Okay, so about being a chiropractor.
Yeah.
I still need to understand what is a chiropractor and what
Great.
they do.
Okay,
Exactly.
I'm going to use my model.
Okay.
Okay. So there's other types of people called physical therapists, physios,
Cardiologist.
cardiologists, that's more medical,
that's
but even in my area where people go to other types of doctors. So they'll deal with muscles, right? They'll deal with ligaments. They'll deal with other parts of the body, where I focus all of my energy onto this red thing here. This red thing here is the disc.
The disc.
The disc, you call it the disc, okay? These are the vertebra, the bones. This is the back of the bones.
So just to get things straight, this is part of the spine.
This is 2 bones in the spine.
Okay, so this one's in the back.
Could be anywhere, the neck, the back.
Okay.
But this is spinal bones. Looking at them, they're lumbar spine. It's the low back.
So the spinal cord is...
This yellow thing here is considered, represents the spinal cord.
Oh, okay.
And these are the spinal nerves that exit.
Okay.
Okay?
Okay.
And what I do, I concern myself with this nerve, and you see that bubble when I press it?
Yeah, I see.
So that bubble is when the disc is expanding, rupturing. There's something wrong with the health of the disc, and it's pressing on the nerve.
So the disc is the red thing.
The disc is the red thing,
And this is the vertebra.
and these white bones are the vertebra.
Okay. Okay. So vertebra sit on top of the disc and below the disc.
Correct.
Okay. Okay.
Yes.
Okay. Now I'm
So my whole world,
yeah.
my entirety of what makes me different than anybody else is that I'm an expert at this one spot,
The
the
disc.
disc, and then where it affects the nerve.
Okay.
Now, why is that so important? Because 93% of that nerve has nothing to do with pain. What does it have to deal with? Function.
Function.
Right. So that nerve goes to the pancreas, to the reproductive organs, to the kidneys, to the liver, right? So, does it make sense that if I pinch that nerve, even if that's 7% of that nerve, right? 7% is what remains for nerve fibers. So, I don't need pain to tell me there's a problem. I can look at an x-ray, I can look at an MRI,
And you can tell.
and I can tell that there's a problem.
By just looking at it through the X-ray.
X-ray, MRI, hands-on palpation. I can tell, I can read this. I can give you a picture of what's happening there.
Okay.
Okay? Now there are muscles and ligaments, and they're all components, and they're all very, very, very important, but I don't treat them. So I'm not going to massage, I'm not going to stretch in order to help the muscles. If I do any of that, which you would say we're overlapping other people's professions,
Yeah.
I only do it because I care about this, that spot, that nerve, and that disc pressing on the nerve. That's what makes a chiropractor a chiropractor.
They specialize in that one thing.
Well, so like everything in the world, there becomes different philosophies. So you remember I said that there was the art, the science, and the philosophy. The art is my personal approach, right? My skill. That's my art. And everyone expresses their art differently.
Differently,
Yeah. So, and every chiropractor, so you have most of the schools out there are not as focused as this. They went more medical in a way.
Okay.
They want to be, they have become much more medical in nature. So, as a result, their philosophy is different, their art is different. So not every chiropractor actually believes in the same thing. It's a very, very undefined profession, which is not good because like medicine, it's very defined. This is what medical doctors do. This is what a cardiologist does.
Yes.
But chiropractor, you actually have to find the individual, the chiropractor that resonates with you, because one may not and one may. But to find the one that is good, that you resonate with, that makes sense to you, that this is the person, yep, that's what I'm experiencing, let me go get that checked out. And I like this way this guy thinks, because it's a very diverse, undefined profession.
Diverse profession.
Correct.
Okay. So looking at that, I'm tempted to ask, you've seen what's here and you've seen what's in the US. Is there any difference between what's here and there?
Wow. So U.S., everyone has insurance, everyone has health care. We don't have people living in villages coming to it's the infrastructure is obviously much different than Uganda. So by the time I see a patient, they've already been to 3 or 4 medical doctors. They've already been evaluated for surgery. In other words, I'm kind of low on the list. Here, people hear something good about me. They might be in a village, they might be in Soroti or somewhere in the West, in Arua, and they hear, and then they don't know what I do, but they just heard good things and they come. And they may come with a condition that I've never seen. So it's as if I'm their first doctor that they're seeing for this condition,
So
which I would never experience in America.
So they have a problem, but they don't know who to go to.
Right, they just heard,
That
and they
somebody
might
has
have
one.
heard, they might have heard crazy talk. Like they might have heard wow, that doctor can heal anything. And so I had people coming from the villages, and then I felt very bad because they were on a bus for 2 days to get here, and I look at their X-ray and I'm like, this is not something I can help you with. So I got into the habit of screening people before they come, that they can't just show up. I have to screen them and see if it's worthwhile for me to see them or not, because it's not a good feeling to have someone drive or come on a bus.
Yeah, I mean, all the way there to come see you.
2 days here, and they don't have money for hotels, and I don't know where they're sleeping, and I'm not inexpensive either, and then in the end, I can't help them at all. So I've learned to accommodate to Uganda, to learn that it operates differently than America. Yeah.
So how have you applied your profession to make it helpful, like to make it kind of meet the standards of the US here locally?
Great question.
So like you have a clinic or something?
Well, for one thing, we like I just came back from Ethiopia a couple months back, where we had a meeting with all the chiropractors around Africa. So Africa is starting to get chiropractors.
Okay.
And we are trying to make associations and things that give chiropractors relevance in the political system, in other words, that we get recognized. Otherwise, we're practicing medicine without a license if they don't know what we're doing, right? So we there are 70,000 plus chiropractors in America. So it's extremely standardized. And then Uganda, there's 5. Botswana, there's 8.
In Uganda, there's 5.
Yeah. In Rwanda, there might be 1. It's very sparse. So there is no governing board. Each country has its own way that they recognize or not recognize the profession. Nonetheless, people don't know what chiropractic is.
Exactly.
In most of Africa.
I didn't know.
Yeah.
I didn't know.
Which is which makes sense. If there's only 5 chiropractors, there's not a whole lot of reason for people to know.
So there's only 5 chiropractors in the whole of Uganda.
When I 25 to 30 years ago, when I started out in Israel, Israelis did not know what chiropractic is. And now it's normal, regular, it's inside the healthcare system, paid for by the state insurance, recognized 100% in that short amount, in that 25 years, let's say. So I could foresee that Uganda will go through a similar process where there might be 5 now, but in 25 years there might be 100.
Well, maybe Ugandans need to know what chiropractors add to them. Mm-hmm. Maybe they don't know what they do, and as well, maybe they don't know where to find them, because if you go to our hospitals here, it's very rare for you to be referred to a chiropractor.
Right, because most people don't know what it is.
Yeah.
So I'll just continue to explain a little bit more of what it is.
Yes.
So my tools, I don't have a knife or any cutting tools like a surgeon. I have no surgery tools. My tools are my hands.
Your hands.
Okay. So what I do is, after I locate the problem I want to fix, I now put my hands on the spine and move the bone in a specific direction. But not just to move the bone. I'm doing it in order to fix the disc. So that you see these threads, yeah?
Yeah.
These threads they represent fibers. And I want those fibers to heal. And I want the disc, the center of the disc, it's called the nucleus, and I want that to recede and go back into the center so that the function of the disc can become normalized. So I'm actually trying to repair, very much like an orthodontist, like a dentist who specializes in straightening the teeth.
Okay.
Okay? So it doesn't happen overnight. Now, they could move your teeth in one day. They can put you under anesthetics and cut your teeth and physically move everything into place. It's possible. But you can also spend a few years moving the teeth more gently.
Okay.
That's my analogy for chiropractic, is that you could get surgery. Now, once you get a surgery, your probability of getting another surgery and another surgery
Keeps going down.
keeps going, gets more and more chances.
Oh,
And I also, once a person has screws and pins and all that in there, I can no longer help them
because they've been operated.
because they've been operated on. So you should always, in my opinion, before surgery, well, let's see if the chiropractor can help. And if he cannot help, you can even try an acupuncturist or another natural. But if you really can't get help, then that's what surgery is. Surgery is the last resort. And it's a great resort. Thank God we have good surgeons. But it's a very permanent thing. And if you're looking at things from a preventative or a holistic point of view, it's not a dig on medicine or a dig on surgeons or surgery. It's just the natural, you should go the natural way before you go the surgical way, before you actually make cuts. The same way that you don't have to cut your teeth, you can put braces on the teeth and move them over time. And then as it'll hurt as they tighten up the teeth until your body gets used to it, but you'll see that the body will actually accept the changes. So a chiropractor doesn't do anything so huge in one treatment. There's two things that I explain to my patients, and there's pain, which is what brings them to me. Then there's the problem.
Okay.
And they're not the same thing, right? So I don't want to fix the pain.
So the pain is in the back most times.
The pain is in the back, let's say, yeah?
Okay.
I don't want to fix the pain. I want to manage the pain. I want to fix the problem.
Whatever problem is causing the pain.
So if the problem, right, is causing the pain, but you tell me, doctor, I feel a little bit worse. I'm like, but that's okay because we've done something. The same way when an orthodontist will tighten up the teeth, the day after or 2 days after, there's pain in the teeth. But we tolerate it because we know that the teeth are eventually going to become straight. Yeah? So there's a little bit of pain in the process of fixing or correcting the issue. So it's the same thing, is that I don't use pain as a measuring device if I'm helping the patient or not. I use my skill. I use my x-ray, my MRI, my hands, and I use that, and I say, okay, now I see that the patient is getting better, but their pain is, so I say, okay, they still have the pain. I'm going to manage it through stretching, icing, different holistic means. So I can manage the pain while I'm trying to fix the problem. But I try not to confuse the two.
So you separate the two.
In my mind,
Okay.
and in the way I explain it to my patients.
Okay.
I
So
separate
you
the
talked
two.
about making adjustment with your hands.
Yeah.
I've seen a couple of videos online. I was doing my research about chiropractic. So what I saw is mostly the people adjusting, people making sounds, the spine, the neck, arms, everything. So what exactly are they doing when they adjust those things and noises come? Is it something that's already...
So there's about 100 different techniques
Okay.
within the profession. You stumbled on a few of them on the internet.
Oh, that was a few.
Right.
And the most common ones.
Maybe, perhaps. Some of the things I see on the internet I think look scary for me and I would never have done to myself.
No, I mean, they make people
So,
lay down and
Yeah,
press the back.
but
then
that's
pop.
the art of chiropractic, how the chiropractor expresses his chiropractic. So for me, I don't rotate the spine because I believe that when you rotate the spine, you're causing a twisting. And that twisting, the same way when people take their neck and they twist, and they're doing it because they're trying to fix their own neck. They're trying to fix their problem. They don't know why they're doing it. They just know they feel a little bit better.
Oh, yeah.
But it never gets better. It only gets worse.
Oh, really?
Yeah, because they're creating micro tears inside the disc. They're creating more inflammation, which is creating more pain. And then they have more pain and they keep cracking their neck. Okay? So I don't twist the spine. So when I adjust or I move the bone on the spine, I do it in a very specific, very controlled manner.
So that brings us to another thing. What are some of the myths and misconceptions? What conceptions you've often had to correct here locally?
So people will often think that chiropractors can kill people. I would say that people who pretend to be chiropractors can really hurt someone.
So they are pretenders too.
Yeah, especially in unregulated countries where people don't know what it is and they can say anything. And I've seen that happen because it's a highly trained motion that I do with my hands, very much like martial arts, right? In martial arts, I can pretend for the movies to go hi-ya and chop you.
Yes.
But we all know that martial arts is using your chi, using your energy, and right, doing a punch or something that you can send a huge man flying, like just with the energy of your body. So it's an art. In other words, I've learned how to direct my energy in such a specific way that it's a healing energy. So that is often something that I deal with. The people they get scared. They think, oh, the chiropractor can hurt us. And someone who's not well trained can, but I can't advocate for them. I can only advocate for me.
Yeah.
And for me, I don't hurt people.
So, okay. Now let's talk about you, okay? Our viewers would like to know, how does Greg stay healthy?
Uh-huh.
Yes.
Okay.
How do you stay healthy? I mean, there's all these things.
I don't drink alcohol.
You don't drink alcohol?
I mean,
that's a game changer.
Yeah, it's occasional, but it's quite occasional. Alcohol is nothing short of being a poison, no matter how you look at it. It's a fun poison. It's a controlled poison. You really can't advocate for health benefits when it comes to alcohol, even in red wine. It's all part of marketing.
So any kind of alcoholic is...
And another one...
There's no good in it.
And alcohol is sugar. That's what alcohol is. It is a sugar.
Uh-huh.
Okay? So sugar, in any refined form, it's not, having natural sugar cane juice, will have a different effect on the pancreas versus white sugar that's been highly processed. Highly processed sugar sneaks past your pancreas's guard, your body's ability to say, hey, we're getting in all this carbohydrate, all this energy. And so what happens is refined sugar becomes completely toxic for the body, which is why we have diseases called type 2 diabetes, which is really called adult onset diabetes, which means it's man-made.
It's man-made.
We created
it.
The disease because of our refined sugars. So sugar, especially in the Western world, is unavoidable. It's everywhere. But here, it may be at KFC stuck into somehow that it might even get into the chicken. I don't know. But sugar is really in fast foods from the Western world, stuff like that. And then that's why you see so much more disease and obesity and these type of problems in the Western world than you will here. And the people that have the obesity and the sugar problems here are the same people that have money and go to KFC.
Ah, okay.
Yeah.
So it's correlated.
It's not a dig at KFC. I think once in a while it's good to enjoy a crispy chicken.
Crispy chicken and a glass of wine.
However, in moderation and understanding that too much of all of that
is not good.
Stuff it's just it's actually poor eating habits means disease. I mean, it's just perfect correlation. You see it. When you step back and see it, especially as a doctor, it's just obvious that you see poor dietary habits equals disease.
So you don't take alcohol, and you take limited amount of sugars.
Correct.
Is it processed sugars? So it means that you don't take too much of the processed sugars.
Always limited.
Always limited.
Yeah.
Like, do you exercise? Do you
So I always exercise.
Okay.
But I also try to get anaerobic exercise. Anaerobic exercise is where your heartbeat goes up, and it's where you get out of breath. It's very different than aerobic exercise. Getting your body anaerobic, you don't need much time, but doing something that stresses my body anaerobically is actually healing for my adrenal glands. So there's ways to stretch, there's ways to exercise for your internal organs, believe it or not. For all the organs, there's ways to exercise. So I make sure that I get some of that. I also enjoy being fit. If I have the opportunity, I like to lift weights,
okay.
right? And it feels good and to be in shape. So there's also another component. Feeling good and looking good means mentally being clear and having confidence and being successful. Can come directly from going to the gym.
I saw you have a bike as well.
Yes.
That's is it aerobics?
That is for pure cycling pleasure.
So you enjoy cycling.
Yes.
Okay.
And it also gets my legs nice and muscular.
Nice and muscular.
Yeah.
So that's some of the secrets that are keeping you young and healthy.
Some of them, yes. And the most important one is sleep.
Sleep.
8 hours of sleep. People underestimate the value of sleep. Your body only heals when it's sleeping.
When it sleeps. I mean, there are people that actually believe that sleep is a waste of time. And these are people that only sleep like 4 hours, 5 hours a day.
So when I sleep, I make sure that I turn off all the lights, the screens, TVs, all of that a good hour before I go to bed, so that my mind can process, can calm down. So when I sleep, I'm not still revved up from what I just went to sleep seeing. So I try to naturally go into my sleep cycle. And then I work very hard at making sure that whatever I have to do the next day, it's at least 8 hours away.
8 hours away.
Mm-hmm.
So do you have any a planned out diet of what you eat in a week? If you can take us through what you eat in like a week,
So yeah, I will. It's not just healthy eating, but it's also how you eat. So I'll do something called intermittent fasting.
Intermittent fasting, which is
Intermittent fasting is where you just give your body a rest from food.
from food.
And
So you stay away from food, no eating.
well, I will eat between the hours of 1 p.m. and 6 p.m. So I'll have my 2 meals. My late lunch or my late breakfast, early lunch is, let's say, 1 o'clock. My dinner won't go past 6. So I have an 18-hour period till my next 19-hour period till my next meal. And then this way, it's not constantly bombarding my body with having to deal with food. But when you don't have food in your stomach, your body can actually use that energy towards healing. But if you're always digesting food, your body diverts healing energy towards digestion. So when you give your body a break, your body actually has that's the benefits of intermittent fasting, is that your body has a chance to heal.
Okay, so I mean, your routine looks to be busy. Like you have being a professional doctor, you have acting, then you have being an entrepreneur. I mean, I would wonder how you juggle all these things together at the same time while you stay healthy, you stay a happy man. I mean, you live life like
everything is setting your priorities.
Setting your priorities.
Like for me, it doesn't matter how busy I am. I need my 8 hours of sleep for my health, and I do not compromise on that.
And you still wake up, you still go act, you still go run your businesses.
The phone goes off. I don't answer business phone calls. I mean, okay, there's always emergencies.
Yeah.
But the phone is off, or as much, I keep it away, so that I don't have my sleep interfered with, for example. Yeah. And then the rest of it is just prioritizing. Literally, what's most important to what's least important, and whatever I don't get in that day, I spills over to the next day. But I don't compromise on what's important to me.
So, I mean, someone would ask, okay? So they have a job, they work the whole day. They don't know how to, live life.
Yeah.
Be healthy, eat healthy, get 8 hours. How would you advise these people? Like, how would they schedule their lives?
There's tons of information. You can look at tons of YouTube videos and podcasts and self-educate. You can also speed that up by speaking to someone like me or someone like you, who's also a health coach, yeah? And the idea is you look at what their abilities and stresses are, and then you cater a program. So, I have a lot of business people or people with 9 to 5 jobs or 8 to 6 jobs or whatever. And I ask them, do you have time to run the stairs? Do you have stairs where you work? Can we get some 1 minute of exercise in at this point? There's different things that you just have to match up with what they're able to do, and then changing their habits. So for example, when I had my practice in New York City, I was 2 blocks away from the stock exchange. And people in the stock exchange are extremely stressed out. Stockbrokers are very stressed out people. And they don't sleep well. They don't have quality of sleep. So I would often go through their program, make a program for them and teach them that they must sleep and prioritize sleep and all of these different factors. And then, oh, but I can't fall asleep, doctor. Well, okay, well then let's look at why not. Maybe your sugars are ramped up. Maybe you're not, looking at what factors are causing the sleep problem. Is it their adrenal glands, their cortisol levels from the stress of their job? What is causing them not to sleep, right? So I would cater I would cater a special program for them where I would get the right supplements, the right patterns of sleep, the right treatments. Everything was catered to fixing so that they could function at their job better and also have the health benefits. So I think it's just everybody is unique and everybody has a unique set of parameters. And so everybody needs to be sat down and examined individually because they're an individual.
Yeah, exactly.
They're not the mass. They're a person. They have specific needs. They have children running around. They have whatever it is. This program for this person may be completely wrong for that person. Plus, your body has, somebody might have a thyroid issue and they're heavy because of that. Someone might have a sugar issue and they're heavy because of that. So treating the thyroid is completely different than treating the adrenal glands. So what works for one person doesn't necessarily work for another person. So it just takes catering the right program for that person.
I mean, you see, in my experience as a trainer, I've come to realize that most people don't, when they say they don't have time, they also don't have time to come and see you. So they would rather get the information from somewhere else that they can apply to themselves. So what I would do is, if I can send out something, let me say, post something on my status, I would do it. Like what to eat, I'll also do it as well, instead of inviting someone to come and see me, which they never do. So, I mean, in this new world now, it looks like most people are spending most of the times on their phones. So if you could send something to them, let me say a message.
Right.
Like now.
Right.
Like how would you advise such a person, in a very small context, how they can live?
Watch your sugars.
Watch your sugars.
Eat as much natural local food as you can.
Local food, nothing.
Make sure you turn the phone off, or away from you when you sleep. Work on sleeping 8 hours and get in some anaerobic exercise. Anaerobic means getting out of breath, and it only needs 1 minute. So the way I do it is I have them do 1 minute separated by 15 minutes, followed by another minute of intense exercise. Could be stairs, burpees, so many different things that can get people out of breath. Sometimes someone has a knee problem, so you have to design a special program to get them out of breath. And then followed by another 15-minute rest by another minute. So it's literally 3 minutes of exercise 3 times a week. So it's 9 minutes of exercise a week of anaerobic. And that's a game changer because it resets the cortisol levels, which resets the adrenal glands, which resets energy in your body, right? Because energy that is displaced or energy that is not disposed of correctly, or it'll becomes a health problem or a sleep problem. So it helps to disperse that energy.
Okay, so now we are back to you again. If I may
I think we've been on me the whole time.
Okay, let's get back to you this time again.
Yes.
Okay, so what part of your job do you think brings you the most joy? Is it chiropractic? Is it entrepreneurship? Is it acting?
Yeah, so I would say the thing that gives me the most joy is chiropractic.
Chiropractic.
Because of 30 years of experience, it's there is so much stuff that I do or know or have learned that is not because of school, but because of experience. And knowing that I'm changing people's lives, it's the most significant way that I make a difference in people's lives. And so, of course, that's the most rewarding.
Okay, so would you advise the Ugandan to go down that route of chiropractic?
You mean as patients?
No.
to become chiropractors themselves?
Yes, chiropractors themselves.
I think it depends on the personality type. If someone's really, really into just making a lot of money, I wouldn't advocate it. It's the wrong profession.
It's all about money, isn't it?
Depends. It depends.
Isn't it about
because
money?
I don't do it for the money.
Okay, you do it for
I
the
often
love.
send people away. I don't think anyone should get into healthcare if it's just for the money, because then I think then that connection to the patient is not sincere, and you're dealing with people's health.
Yeah.
Okay? So, and I also think that people need to match what their personality is, like what they like. If they don't like being touched or they don't like touching people, this is not the right profession for you.
Then they can't do it.
Yeah.
Okay.
Right? Would you ever suggest someone who doesn't like working out at the gym? Would you say you should become a trainer?
I wouldn't.
No.
Yeah.
But because you love and you have a passion towards working out, becoming a trainer is very easy for you. It's not work.
Yeah, it's not
It's
at all.
something that just is who you are and you sharing it. So I think that someone needs to know who they are and then see if this is something that they can share and not, imagine having to do this kind of work and disliking it. You could never be successful. You would just be abusing people. But because I love health, because I love people, right, and all of these aspects, those are the fundamentals that make up being a good chiropractor.
Okay. So it's not something you would do if you don't love it. You have to first love it before you go into it.
Yes, but a lot of people don't know what they'll love. So that's why I say know who you are, know your personality, and then match the profession to your personality. For me, this is the perfect profession.
That's not an easy thing to find out.
But that's what I tell every young person who doesn't know what they want to do.
I mean, and someone would ask, how can they get to that part of knowing what they actually love? Because it's not easy to
Visit, like let's say they were thinking of becoming a medical doctor.
Yeah.
Visit the medical doctor, see how they work. Does it excite you? Do you like it? Does it bore you? And you want to run, right? Does it fit? Exactly. Put effort into figuring out what resonates, what makes sense to your personality type. And you can only do that by exploring, by going out and saying, I'd like to follow you for a day. I'd like to learn what you do. Yeah? That's how I became a chiropractor, because I loved what my chiropractor was doing.
Yeah. So you've seen Ugandan patients. You have some, right?
Many.
Okay. So there are so many.
Yes.
What do you think is the main cause of their problem coming to you? Is it sitting in office for too long? Is it lifestyle? Is it lack of exercise? Or it's mostly injuries?
It's really everything. It's I have to be honest with you.
Yeah.
It's yes to everything you just said.
Because I'll refer to me.
Yeah.
Whenever I get a client who has a back pain, when you ask them what they do for a living, it mostly has something to do with sitting for too long.
Right.
So they end up with back pain.
So did you know that there's a correct way to sit?
For that, I know it is, but I know it's hard to do. Me, myself,
So
I
it's
can't
actually
practice
extremely easy. And can I share it with you?
Yes, please.
Okay. So you have the camera in front of us is on a tripod.
Yeah.
If you only have two legs working, the tripod would fall and the camera would fall.
Yeah.
So we also have a tripod in the body. So we have the two hip bones and then the sacrum. Okay? And we're supposed to sit on our tripod. And if you sit correctly, it makes a world of difference. So for example, instead of sitting like this, I'm only on two parts. I'm only on my two hip bones. What I do is I make sure that I sit on my tailbone as well. And then when I sit, it's very easy and it's very natural. Now the way to know if you're doing it wrong is if you're sitting here wrong, and then you're doing this. So there should be no effort here. Now if I sit correctly, there's no effort, it's natural. And then when I move, so let's say I want to read this piece of paper. Instead of doing this, I can use my hips as my pivotal point. And then I can use, so see my entire spine is now straight. Mm-hmm. So there's ways to do everything. There's ways to sleep correctly. Mm-hmm. I often have people put a pillow between their knees. So there's ways to sit correctly, sleep correctly, eat correctly. Everything can be done better.
Same thing with taking care of your back.
Taking care of your spine, absolutely.
Your spine, brother.
Yeah, same thing.
Okay.
Umugongo.
So they have to sit upright.
You want to sit correctly.
Correctly.
And then you want to pivot through your hips. In other words, I'm not moving from here. I'm moving from here.
From the hips.
Right. And then sitting is now, if you're doing that 9, 10, 11, 12 hours a day, you might as well do that correctly. That'll help your spine.
You know, that's hard to do.
It takes about a week to master.
It takes a week to master.
Yeah.
So who should they go to learn how to sit correctly? Do they have to come to me, the trainer, or they have to come to see you?
Yeah, actually,
it
doesn't matter where they get the information from. It could come from you, come from me, or come from a podcast. It could be a separate podcast, yeah? But it could be all of these things. It doesn't matter how the information gets to them.
Yeah, because for me, what I do is I try to incorporate the exercise bit of it to strengthen the muscles that are weak. Sometimes it helps, but if they keep doing the same thing that they're doing, sitting incorrectly.
If your car is misaligned, but you keep strengthening the car, the pieces, but the tires themselves are still misaligned, is strengthening that the right thing to do?
No.
No.
Yeah.
Why not first fix the misalignment and then strengthen it around? So correct the posture and then tighten the musculatures and the ligaments around the corrected posture.
Okay, so they should first come to you to be aligned.
Correct.
Then they can come to me to strengthen those misalignments.
Yes and no. I don't think it matters who they see first. I think that it's more important that you and I work together and know how to refer to each other. And then I also think that it can be done simultaneously at the same time.
At the same time. You know, that could be expensive.
It's not my problem.
That's exactly why we're here. So you can make it inexpensive for some.
So I work with Dr. Bob, who's a naturopath. And, two heads are often, if people get their egos out of their way and there you have 2 good doctors or 3 good doctors that just want what's best for the patient benefits.
Yeah.
So I often will work with my colleagues. And it is too expensive. And then what we do is we see them together and they pay for a visit. That's we call collaborative care. They're paying for us as a team versus just as an individual.
Just an individual.
And then, we might get paid less as individuals, but we know that overall the patient is benefiting, and it just makes sense. So, I think it's just up to the doctor. If a patient wants to see all of us, then I think it's up to us to make it affordable as well.
Okay, so for the patient that can see all of you, we shall make that known.
Yeah.
And for those that can't?
So they can see one of us at a time.
Okay.
And they can also take tips and start implementing them, like eating correctly or exercising or any of these things. That can happen right after they watch this podcast. There's no defining rules, right? I'm not there to they don't need me to do those things. I might be able to give them a structure that makes it more, makes it better, right? I can do it better than, I could take 50 hours of watching YouTube videos and I could condense it into 5 minutes for the patient because that's what I'm trained to do, yeah? So I'm also a time saver because that's the knowledge that I can offer the patient.
Okay. So, this has been really a lengthy one. We need to come down a little bit. I'm sure you have things to do. Okay.
I have nothing to do other than talk health with you.
Okay. Okay. So, as we're closing up, there's a friend of mine that has been having serious hip pain, and he drives to work for almost 3 hours, and then he sits in office for the entire time.
Right.
Then he has to drive back home, and then he doesn't really get that time to do whatever you've talked about. Now, is there anything he can do for himself?
Sit correctly while you're driving those 3 hours.
Yeah.
Sit correctly when you're at work. Walk around a bit in between, right? Split up it, do something. So for 3 hours, maybe you need to leave a little bit earlier so that you can walk around the car and stretch. I would say those immediately are things he can implement. So just a way, just how I showed you how the patient should sit on their 3 points, that can be done in a car as well, and that can be done at work. So that should be the first thing he should change.
It's not rocket science. They can do it in the car and at home.
Correct. Posture is extremely important.
Okay, so where can people find you?
Where can they find me?
Yeah. Do you have like social media account? Do you have a
Well,
website? You have an address?
So great questions. Right now, the office is right here,
Okay.
which is Nachiwogo in Tebi.
Nachuoga and Tebe.
Yeah. And I have an email, which is called Uganda Spine
Uganda Spine.
at gmail.com, Uganda Spine. And then the website, yeah, I think for the purpose of this podcast, because we can always alter it, we call it ugandaspine.com. And then even if it takes you to another website, that's a very easy thing to make sure. The reason I hesitate is only because there's been some massive shifts that have happened in Kampala where I had an office, and so there's a lot of dynamics now. Okay. A lot of things have changed, so the information is actually changing. But those we can keep as that Uganda Spine will work.
Okay, so as we close up, the show is called Health and Hustle. So I'm going to ask you what your routine is, like your workout routine. Mm-hmm. You're going to give us exactly what you do for a week. Mm-hmm. And then for the hustle, you're going to give us exactly what you do for a week. So on the health part, what do you do for workout? Do you do like a Monday biceps, Tuesday cardio, things like that?
So every morning that I get up, I try to do what's called the 5 Tibetans.
5 Tibetans.
Tibetans.
Tibetanese.
Tibetans. And you can find it all over YouTube.
What's that?
And they are exercises that actually exercise the whole body, but they also work on the balance, on the ears. You know, so when people get older, they lose their balance. Uh-huh. So balance is a very, very important thing to exercise, to keep. The longer in age that you keep your balance, the more you can exercise, the healthier you are. So I believe that they're focused on balance as well as also toning the core, making sure the core is toned.
Okay.
I'll go for a bike ride. I'll go for a walk. I split it up. A walk is not anaerobic. A bike ride, if I pedal really hard, is anaerobic.
So let's say it's 5 days of a week. You work out 5 days a week, is it?
I would say, on average, I get at least 5 days.
Okay, so
out
first
of the
day,
7, I'd say 5 days.
So first day?
So the first day, let's say I bike to the gym, and then at the gym I'll do, usually I'll do my core first. I actually like to do my stomach because I'm a bit superficial. I like to do my calves.
Calves, yeah.
So I do my stomach and my calves.
And your calves?
And then I'll do either back and bis or chest and tris, something along those lines.
And then you have day 2?
Day 2, I'll do, so let's say day 1 I did back and bis, so day 2 I try to do chest and tris.
And then day 3?
Let's call that the rest day.
The rest day. So you rest on day 3, and then day 4 you repeat?
Could be legs.
Okay.
It could be a repeat.
And day 5?
Yeah, there's always a body part that I'll want to work on. Or maybe that'll be a day that I'll really push to ride a bike for an hour or 2, like something substantial, where I get a good amount of exercise.
Okay, so on the hustle side, we have 5 days of health, being healthy, which is exercise. And on the hustle side, you have Monday, is it chiropractic, is it acting, is it running businesses, or it's everything all together?
I would say we're seeing patients at least 3 days a week.
3 days a week.
Yeah.
And then the 2 days?
2 days is for me to enjoy.
To enjoy. You know, there are 7 days in a week.
So
You have 2 left.
I every Friday to Saturday I keep the Sabbath.
Okay.
And the Sabbath is not just a physical, but it's a spiritual day of rest, where I can actually not just shut off my body, but I shut off my mind.
So that's 1 day dedicated to just resting and shutting off.
Correct.
Doing nothing to do with work.
Yes.
Okay, that sounds pretty healthy. Thank you so much, Dr. Greg
My pleasure.
Salman, for being on the show. You're the very first guest we've had on the show.
Very nice.
Thank you for being
Pleasure.
very much.